To some more of these top headlines. We've been giving you all the latest updates as far as what we know right now about Damar Hamlin's condition, the safety for the Buffalo Bills, who was carted off the field in an ambulance last night during the first quarter in that game there. The game has been indefinitely postponed. It will not take place this week. We don't know when that will be rescheduled. We've been hearing from NFL officials. We've been hearing from the family of Damar Hamlin as well, but so many have questions. I've been speaking to family and friends all day about this, how something like this could have happened to a healthy 24-year-old professional athlete. Let's talk about this even further with sports medicine doctor, Dr. Dan Savarino, joining us right now. Dr. Savarino, thanks for being with us. Okay, so a lot of the conversation just from everyday fans, everyday Americans who were watching the game last night, how could something like this happen to a very healthy 24-year-old? I want to put up the tweet here from the Buffalo Bills. This was from earlier today, saying Damar Hamlin spent last night in the intensive care unit and remains there today in critical condition at the University of Cincinnati Medical Center. We are grateful and thankful for the outpouring of support we have received thus far. Cardiac arrest. What does it mean?
So cardiac arrest is basically when the heart stops beating properly. It's an electrical issue as compared to a heart attack, which is a blood flow issue. So I was a bystander just like everyone else watching the game. And from what I saw, this looked like a condition called commotio cordis, which is blunt trauma directly at the chest in the area of the heart, which basically makes the electrical signals of the heart go a little haywire and causes something called ventricular fibrillation. The blood flow cannot flow properly, and then you go into cardiac arrest.
Okay, yeah, that was my next question. This is a Latin term. You described it very, very well there for us. We were seeing it kind of being thrown out there last night. Now, something that still, I guess, needs to be determined, and from your point of view, your professionalism, do you think the hit specifically caused it, or was a contributing factor, or was this just some type of fluke event there at the football game?
So we don't know a lot yet. We don't know if he had any underlying cardiac conditions. Commotio cordis is typically with a healthy heart. So if it was that, then he wouldn't have any health problems. But again, we don't know if that was an issue that maybe he didn't even know that he had. But basically, it is kind of a fluke event. Commotio cordis only happens in about 10 to 20 cases per year because you have to hit the exact part of the chest at the exact time that the heart is in a certain part of its cycle for this to happen. Otherwise, it doesn't happen.
Okay, Dr. Savarino, though, we know he was administered CPR for upwards of 10 minutes. We know he has been intubated as well in the ICU. When you get administered CPR for that long, are you worried about lack of oxygen to the brain?
Well, absolutely. I mean, certainly the longer it takes to get that heart going, the worse the prognosis. But good CPR keeps that blood flow going while they are trying to resuscitate him and bring that heartbeat back. So hopefully they were able to do good CPR. They did it very, very quickly. You know, that's the good part about having an emergency action plan with sports and, you know, having that whole team involved so they can jump in there real quick and try and have the best prognosis.
You know, that was the thing. If Damar Hamlin was not a professional football player playing in a game with all of that medical personnel around him, if he was just someone, you know, like me or someone watching, how quickly would he have to get help if something like this happened?
Well, this is literally a game of seconds. You know, every second that brain and that heart is not beating and that brain is not getting blood, you know, the prognosis goes down dramatically. So basically every minute that heart's not beating, your survival rate goes down by 10%.
Okay, Dr. Savarino, though, what is the recovery like? He's still in critical condition. Does he have a long road ahead of him?
It all depends. So it depends on if this was just, again, that blunt force trauma that caused, you know, the heart to stop. It also depends on, you know, if he was down for how long and if there was heart damage, brain damage. So there's a lot of factors that go in that. When I was a resident in the hospital, there were some times where we resuscitated somebody, they went to the ICU, and then 2 days later they walked out of the hospital. And then sometimes it took weeks, months, or sometimes they never did. You know, so there's a lot of variables. So it's hard to say right now, you know, what the prognosis is and how long his recovery will be.
Doctor, when people, though, you know, ask me or ask you, and they're talking about this, so many are talking about this story, and I'm going to kind of bring it back to the first question, how someone, you know, so young, so healthy, could have this happen to them. They're a professional athlete. What do you chalk it up to? Is it just a random event? We obviously don't know the underlying conditions like you mentioned there. Maybe we'll figure some of those out if there are any. But people are looking for some type of rationale to wrap their heads around this today.
Yeah, again, we don't know everything. We don't know if he had any underlying cardiac conditions, something like hypertrophic cardiomyopathy, which is a main cause of death in athletes. If this was something like commotio cordis, which was what it looked like to me, then it is really just kind of a freak accident. It was a hit in the exact right place at the exact right time. So until we know more, it's really hard to speculate as to, why and how this happened.
Yeah, I'm trying to think if there have been any instances of high-profile figures who have experienced something similar to this and have not had such a great outcome. I can't think of any at this point in time. Dr. Severino, what will you be looking out for in the next couple of days? And we're all hoping for the best for Damar Hamlin, his team, his family, and we hope that, he can be stable very, very soon. When do you think that's going to come, if at all?
Yeah. So, I think the next couple days, what they're going to do is they're going to probably try to stop the sedation. They're going to see if he's able to wake up and, if there's any brain damage and they're going to obviously run tests to test for brain damage and heart damage. And again, it all depends. It could be, again, something where he walks out of the hospital in a couple days, or it could be something where he's there for weeks or more.
All right, Dr. Dan Severino, we appreciate your insight into all of this. We'll probably be speaking again. This story, no doubt, is going to have legs going into the week. Doctor, thanks so much. We appreciate it.
Thank you.